It says mother's mind here, and my name underneath. I don't know why.
It's just
more clear
warming.
yesterday.
Just wait a little
More
bit.
light. Okay, it's clear, but it's just not very bright.
Okay, just give us a minute. You're waiting for it to what? Warm up.
No. I mean, this wasn't clear.
Oh,
because it
okay.
was not warm.
Can?
Yeah, can.
Okay, so I'll introduce who I am first of all, so you know. I suppose I should say I'm a father. It's like this is all not new to me. Having 3 children, I've seen all this before from a different angle. I work in Hong Kong in a clinic called the Life Clinic. I work with an MD. It's like a family clinic. Also doing nutritional work. I don't do the nutritional work. I'm with a nutritionist. I work with an MD, and I work with a clinical psychologist working on family and relationship issues. So it's kind of like I'm doing manual therapy and energy work. So I'm sort of doing that there. And what I do in that clinic is I do quite a lot of clinical body work for mums who've had cesareans, and the scar tissue can cause knee pain, neck pain, back pain, just because it's pulling all the tissues inside and causing problems. But to give you more of my background, I'm trained as a physician in Germany, something called a Heilpraktiker. That is not an MD, it's more like a naturopath. I've got a license as a body worker. I'm a psychology major at the Upper Iowa University. I'm a Kung Fu master of 30 years, so that's useful sometimes, all the time actually. I'm a Tai Chi master, so I trained for 25 years in formless Tai Chi, and I developed some energy work, so I trained in various energy modalities apart from Tai Chi, and I developed some energy work. And I wanted to talk to you about them today. And actually, yeah, I think I would go forward one more. I don't know if you can see this, but I thought what the agenda is, has anybody here had some neck pain or back pain since being a mum? Yeah? Yeah, okay, we've got at least 3. What about like issues with breastfeeding or not sleeping through?
Not sleeping.
Okay, so we have, so you could say like, what I want to do today is show you how you could potentially support each other and support your children with a method that's very, very simple to learn. And I thought I'd give you some examples, and it's using, I think, somebody was saying, I'm using my phone, I'm living on my phone. I'm like, I live on my phone as well. I read books on my phone, and there's a lot of communication. I think I maybe do 2 telephone calls a day, but I don't know how many texts I do. I do a lot of texts every day. So I've just got an example of what we're doing on our WhatsApp group. So friend Chris is nervous about proposing to his girlfriend. Can you please, it's called Wickes way, the energy method. So 2 people, 3 people worked on it. Okay, update, was nervous 5 out of 10, he's now 2 or 3 out of 10 relaxed energy. Here we have somebody, Shirley Wong. Nephew Garrick has diarrhea, feeling no power. Wickes way for him, please. On it. Thank you all. Still have pain in the tummy, but not as bad this morning. His tummy pain is at 4. Now we went from 10 a.m. and that's at 1:15, and then the next one 5:30. Tummy pain has gone. So we've gone from a day of doing this energy work, and we've helped him. And we've done it a lot with. I've been very careful not to put anybody that you might know from Singapore on the group, I think, yeah? So, but we're using it for all sorts of things. In Hong Kong, there's a load of mums, which my baby's not sleeping through the night, and we do some energy support. So what we're really sort of talking about today is some solutions, energy management and support, so what you can do with your energy. Like, I don't know if you know the Chinese say, qi sui yi, li sui qi, which means the energy follows your intention, yeah, and the power follows the energy, yeah. So you can actually do quite a lot with your mind, yeah, just sending that. And that's if you're believing in things like acupuncture or qigong or that sort of thing, then it's like, yeah, of course, yeah, duh, as they say. And this is actually what I'm saying is this whole method has kind of taken a whole big change because of the new technology that we've got. And I thought I'd do a demonstration. So if somebody's got back pain today, maybe we could work on it. So I thought I'd go through some of the issues that you might be having with breastfeeding. The baby doesn't want to eat, you don't have enough milk, you have too much milk, sleepless nights, you can't sleep, or the baby can't sleep, fatigue. You're producing or have been producing for 9 months, you know, you've been producing for 2 people, yeah, and then suddenly also producing for 2 people for a number of months if you're breastfeeding. So there's quite a lot of energy going out of you, and you actually, the baby thinks it's part of you, so you kind of have 2 minds at the same time, energetically, yeah. So it's quite a lot, okay. Back pain. All of this fascia, so the connective tissue here, is connected from the pubic bone to the lower back. The lower back has a direct relationship. If I put my lower back backwards like that, I put my neck backwards. So you could see there's a direct relationship with the lower back. The tailbone, how the tailbone is twisted, can all affect how your back is hurting or how your back feels. So that's a really important point. The baby blues. I'm not talking about a full-blown depression, but I'm talking about just feeling low. You can do a lot with this sort of method. And identity. Your world's completely changed, basically. So who you were and who you are changes from one day to the next, and dealing with that is generally an issue. And the amount of control. I remember before we had the kids, you leave the house in 5 minutes, and then you leave the house and it's still an hour later and something's just happened, and yes, got to unpack, and now I've got to change the baby, and you know, so yeah, like the things are a little bit different for the first few months. So how are you going to deal with this? So reactions and solutions. I say one reaction is to get stressed. That's a solution. That's actually sort of our main thing. So you've got cortisol going through your blood, you've got adrenaline going through your blood. Who gets the adrenaline and the cortisol? Also the baby. So you get stressed, the baby gets stressed. Yeah? And also if you believe in energy, your energy field is going to affect the baby's energy field. Okay? Physical support. You get somebody to do some of this stuff for you. You get somebody to do a massage. You've got a back pain. You get somebody to look at your back. Of course, this is a reasonable solution. Medicine and chemicals. So you're stressed. You take something to calm you down. Again, there's always like what you're paying Peter to rob Paul with that one. So you're going to get a benefit on one side, but you may well pay for it and in other ways. And unfortunately, medicine, even these days, I mean, I'm at the era of thalidomide. I don't know if you've heard of thalidomide, but that was a drug that was given out to pregnant women of my mum's age, and the children all came out with deformities, so missing limbs and things like that. So medicine has a history of being a bit risky sometimes. Exercise, the best detox in the world, so go for a walk, move, that's a good solution, if you're not exhausted, that is. And then energy management and support, so that's really what I'm here to talk to you about today. The good thing about energy management and support is it's drug-free, it's holistic. So when I'm looking at, I don't know if you know about feng shui, yeah? So you're looking at even the way your home is, so the energy flow in the home makes a difference, what sort of weather it's like, what moods there are in the house. It's very, very holistic. It's not looking at just one aspect. So your diet's important, your state of mind's important, your posture's important. Everything could be related. So that's what holistic means if you take it with the W-H-O-L-E, holistic. Distance, so you can do it over a distance. Obviously, if you're doing the stuff over a distance, the mind, if you think about your bedroom at home, you think it's a second, so that's how fast the energy travels, yeah? And then whether we're being client-oriented, so you're actually speaking to somebody or going to meet somebody. That's obviously a different situation. Now, there's two ways of approaching this whole subject. One is healing, so you have a problem, yeah, and one is called neutrality, so or making you strong. So, if I'm saying you're sick, I'm that's a bit like putting you down a bit. So the whole approach is like you're not sick, but you're weak in certain areas, and if you're boosted in those areas, you'll be strong. So it's a bit like the acupuncture system of the body. If you imagine it as like little tubes, some of them got flattened, but you just want to pump them up and allow the energy to flow through, and then you just suddenly feel strong. Yeah? And you know what that's like. If you've ever had a bicycle with a puncture, you know what it's like to be on low air. So there's various energy modalities. There's Reiki, traditional Chinese medicine, where you're working with the energies with herbs or with needles. I'm sure prayer is good. Kinesiology, again, that's very problem oriented, so healing oriented. Your method, and lastly Wickes way, which is really what I'm going to be talking about. Wickes way, they're both much more about neutrality or strength orientation. So, what is energy? I always say, what is not energy? If you think energy is just an Asian phenomenon, you have to talk to Einstein, because Einstein said E equals mc squared, which means actually everything is a vibration. So there is no such thing as something which is not a vibration. That's a kind of unifying theory. So what is not energy? So it's connecting everything. So it's connecting your mind, your body, your spirit, you to each other. So you really, I don't know if you've had the experience where you feel that like somebody you know's had something really good or really bad happen, and you suddenly thought of that person. That's a very typical sort of connect. What's the word? It's kind of showing you're connected to the energy. So the baby and you are very, very strongly connected. Energetically, everything is equal. So there's not really a hierarchy of energy. If everything is energy, and there's no energy which is better than any other energy. The good news is, hello. The good news is, of course, anything or everything can be worked on energetically. So I talk about a lot about unconditional love. So if you're thinking of unconditional love, you're thinking of something which is if everything is connected, yeah, and the mind is connected to that energy, then I can't judge anything better than anything else from an unconditional love point of view. So that's kind of the most basic nature of our mind and energy. Okay, so in that case, I say, well, nothing really matters. Well, the Chinese obviously have a healing system which is based on this energy, and of course there's something called virtue. So of course there are things which work a lot better in our energy system. So basically what happens is on our groups is we're connecting people to unconditional love, and we're using that, so we're letting people know they've got a problem, and then so they're letting us know they've got a problem, and then we're connecting them with unconditional love, and their problems are changing. So you get to be caring for yourself and for others, because everybody's working together as like a network. And while things are changing in your life, you're able to give yourself and other people support. So you can work on your self-image as things are changing. You're learning as you're learning about energy, and you're learning about yourself and learning what other people are going through. You're learning self-discovery. You're able to rest better. We talked about this being a bit of an issue for you guys. And the idea that just by being connected on the WhatsApp group, and I think you already have a WhatsApp group, don't you?
We have different kind of WhatsApp group, but I think what Richard is trying to say is the support that you get. So like, when you engage doula services, the doula is there for you, and then for some of you, your classes, you started your own WhatsApp group and you're talking to each parent, or the groups kind of thing is always helpful. So he's talking about setting up a WhatsApp group where you do energy work together. Yeah. Supporting each other that way.
That's the phenomena that's happened in Hong Kong. So it wasn't planned, it's just happened. Yeah. So you start saying, I'm worried about this. I want to hit this goal of, my baby wants to hit this developmental goal or whatever, and you can move towards those goals. You help each other, and you help yourself. And you're improving your connections, and especially nowadays, especially with this social media thing, the way that everybody's sort of on social media, you're not necessarily making these meaningful connections talking about your problems on Facebook. People are much more concerned about looking good on Facebook, yeah? And this is an area you're actually able to sort of share your problems. And I thought I'd let you know that like all of those things I mentioned there are what the APA, so the American Psychological Association, calls resilience. Resilience is your ability to cope with problems. So when you're able to, and this is really important, you pass this on to your child. So a child which is resilient is able to deal with so many more problems in life. The things that you need for resilience are connections, self-image, self-discovery, help others, self-care, breaks for rest and recuperation, acceptance of change as part of life, and moving towards your goals. And there's another couple, but it's like 10 different things that the American Psychological Association says, if you've got it, if you want to teach it to your child, you need it. Yeah? So what was happening is people are busy, mums are busy, they're very much sort of event driven, I think you'd agree. Yeah, suddenly something happens and you just have to deal with that. And so somebody would say, I can't, little Jade didn't sleep through the night, can you please help? And people will just, through the day, as they notice it, they'll be supporting, and then we'll get a report later saying, oh yeah, whatever's changed. People on the group, they're doing it as and when they can. There's no obligation, so if you don't have any time, there's also, I have a rule that there's no advertising and no chit-chat. So it's just about helping. So I suppose this is the part where I say, has anybody got any pain? Back pain? Neck pain? No back pain? Back pain. Back pain. Okay, so I'll give you an example, because I think what's a bit difficult with this sort of stuff is understanding, especially, has anybody come across this sort of stuff before? Yes? Yes, okay. So I think it's sort of understanding, so have you come across EFT? The tapping? So Reiki, or which did you come across Reiki? Okay, so Reiki is very much more, it's much more something much more spa-like. Somebody lies down and you hold the hands on them for half an hour. Well, that's not going to be very practical for somebody who's a busy person who's got like 30 seconds to use, yeah, or 2 minutes. So I don't know how long, and I don't even, know what's going to happen. But okay, let's ask you. Your back pain. So it's in your lower back, is it? What's your name?
No worries.
Victoria. So Victoria, it's in your lower back. And what is the pain out of 10 right now? You have 7 out of 10 back pain. So is 10 out of 10 the worst? Okay, and it's 7 out of 10 right now. This moment. Whoa. Okay, all right. So the nice thing about this method is it's not complicated. It's very, very simple. So first thing, we're just going to work on it. Just tell me how it feels when I'm working on it. Okay. Okay. How does it feel now? Is it still 7? It might be. But it's still 7. Okay, how about now?
No worries.
Still 7.
But? No but. Okay, any change? No change. So what I do in this case, because I'm doing a demonstration, so it's 7 out of 10 and exactly the same place. Can you imagine taking it out of your body and putting it in front of you? What would it look like if it was outside your body? So what colour has it got? If you were to take it out of your body, put it in front of yourself.
If I went down, it's actually getting worse.
When you put it down,
Yes.
is that always like that or just
Yes.
now?
When I nursing, I will actually have the back.
Oh,
My
okay.
back will usually have the problem.
When you're nursing, but when you put it down, you feel better. You feel worse.
I feel worse. Yes.
The pain. Okay. So how's that now?
I feel better if I'm at rest.
How's it right now? Is it still 7?
Now, slightly better. Slightly.
What is it? Is it 6.9? 6.5? Is it a 4? I don't know. You gotta give me a number. I know it's not necessarily easy. You're not used to doing that.
Yeah. 6.5.
Okay. All right. I'll take 6.5. Okay. How about now?
Same.
Exactly the same. So it's really moving quite slowly. Can you try, if you could imagine, like taking it out and putting it in front of yourself? Do you imagine that? You let the pain move in front of yourself. Okay. And then what colour is the pain? And what shape?
It's like a golden color.
Okay.
It's kind of brown.
Golden and round. Okay.
Yeah.
Just keep your eyes on it. Let me know if it changes at all. How's that now? Exactly the same? Okay.
No, this is a support.
How's that now?
It's getting like smaller.
Mhm.
It's very
Okay. How's it now?
It's still the same, but it's getting smaller and smaller.
So the image is the same but smaller. So how's it now, Victoria?
It's still there.
Yeah.
Now.
And now? Changing colour, changing if it's moving or not moving.
It's still at the same spot, but it's not changing colour, but it's getting smaller and smaller.
Is it, how small is it now? Like much smaller, half the size?
Maybe a fist?
It's a fist, and before it was much bigger?
Yes.
So I'm just, seems like I'm just talking or just doing nothing, but actually I'm continually connecting unconditional love. So it's very, very simple. Okay. Just keep an eye on the image if you can. So how's the image now? Is it still fist size?
I think it's gone.
It's gone. Okay. So take whatever you think the image is, take so the nothingness, take it back in because you want to replace the energy in your bag. So mentally, whatever was there, take it back in. So close your eyes and take it symbolically breathe it back in, all the energy. And your back pain was a 7. So what is your back pain now? A 4. So it's gone from a 7 to a 4. That's a bit easier for the day. Now, I'm not saying that we do this once and it's done forever, but I'm saying this is something you can do. Like if 10 people were doing the method, that would be 10 times faster. Yeah, for you. So I have about 35 people on my group. So that makes quite a lot of, even if you've got 5 people, it makes quite a lot. So can I ask your back pain? Can we work on that a little bit?
It's okay from my back, but
You're lying back, okay. Any headaches, worries, headache?
headache.
You have a headache now? So what's your headache out of 10?
8.
8 out of 10. Is it the front or the back?
It's like this.
So going from the back to the front and the side?
From the neck.
From the neck to the front, okay. And how long have you had it? Days? Days?
It's on and off, yeah. It's
On and off.
on
Okay,
for
so-
years.
My clinical training is going to ask me to do something, which is always for a headache. It's the most differential diagnosis in the world. Always, please consider seeing a doctor. Okay, but now I've done that. I've fulfilled my obligation to you. Yeah. So now I'm going to work on it energetically. So I've just done connected twice. Is it still? What did you say? It was a
It was 8.
8. What is it now?
It feels warm.
It feels warm.
It's still
It's still
there.
an 8.
It's
Okay.
still there.
Is it an 8?
It's 8, yes. It is around 7, but it's shifting all over head.
Mm-hmm. now?
It's around 7.
Yes. So what I was doing, I don't know if you know about this, but in psychology we have this theory of when something's very difficult to deal with, we dissociate from it. So what I do is, that's the natural approach. So what I was doing with Victoria was I was saying, okay, let's take the pain out of you, that's dissociating you from the pain. And then I'll work on the outside of you. Because honestly, when I was doing it before, it wasn't changing. So it's a little bit like you're holding on to it, okay? And that's not like a judgment, that's just what we all do. Sometimes we hold on to it, and sometimes we kind of become like all a bit blurry and foggy headed. That's called when we're dissociating from something. Yeah, we don't feel it at all. So that's what we do. But I'm going to work with you associated if I can. So I've got it from an 8 to a 7. Are you having digestion issues? Okay, because I'm picking up, this is a bit of intuition that you've got a bit of a digestion issue on this end, this valve here, so the ileocecal, ileocecal valve. So I'm just going to include that. And a bit stressed at the moment. So it's coming up like, sometimes you can feel that people have just got, it's here, really. They've got headaches, but it's like, it's a tension that's there. So I'm just going to include those.
Headache is better.
Can you try and give me a number?
6.
From a 6. Yeah, I got it to be about 6. No back pain?
I have neck pain.
Yeah.
No, there's no pain there, but there's problem there.
So I just include that as well. How about now?
No, headache is still the same.
So is it 6, is it?
Yes. That's
Okay, how about now? It can still be the same.
yes,
You know,
it's I mean,
it's fine.
The feeling is changing, but the number is still 6.
okay, so the feeling's changed, but the numbers are 6. Okay, so let me do a dissociation. So dissociation is just. Have you got to go? So I won't go this way.
Okay.
So yeah, what I do is like, you just look at me for a second. So you just like take it out, put it in front of you. What do you see in your mind? And anything you see is okay. Just make an image. It might be just a color, it might be a little cloud, it might be a ball, it could be anything.
It's a ball of purple black.
Purple black. Okay. All right. So just observe it. What colour is it now?
It's sort of the yellow, orange, red,
Yellow, orange, red.
and
Okay.
it's hot.
It's hot. No smell? So very often somebody's limbic system will kick in. The limbic system is very connected with the smell, and then you know it's a really important issue. Actually, it's kind of a powerful issue. So they might feel like that smells really bad. It smells disgusting. I want to move away from it. This can really make quite big changes in people once they clear their limbic system, because the limbic system is protecting you for fight and flight. Yeah, it's your most basic part of the brain. Okay, so on this it's not like that.
It's becoming more transparent and smaller.
Good. So there's no necessarily talking you through this. I don't need to be here. I could be in another room. That's why it works so well on WhatsApp.
After you're done, I'll share the example of the BP one.
Sure.
Mm.
How's it now?
It's becoming more transparent.
Yeah.
It's like this, spreading around.
Okay.
Spearing, but it's a little bit there.
Still a little bit there. That's quite normal. Just let me know when it's gone, yeah? Gone?
It went like into clouds, into universe.
Okay.
So it became clouds and then
Close your eyes. Just breathe any energy you need from that experience back into you. And when you open your eyes, you've integrated it. So just open your eyes when you're ready. And then we'll ask you how strong your headache is. It was an 8 out of 10. 10 being the worst pain you could imagine. Okay, always, yeah. And 0 being no pain.
it's about 3 and it is warm.
3 and it's warm. And is it still the front to back, or is it just
No, it's just front.
just front? Okay, so I think you'd agree, like, given the options of taking pills, yeah, painkillers or whatever, it's quite a cool option. What I'm saying, the phenomena is that, yes, I do personal sessions and I work on traumas. I've worked on quite severe childhood traumas. I've worked on phobias, all with this method. So it's kind of nice because you don't have to talk so much. Yeah. There's quite a big reduction. And how long does it last? It's however long it lasts. It's the same as a headache pill, honestly. But I must say, for some of the stuff I've done, it's been permanent. Especially if you're dealing with a past issue. If you feel better about it, generally you feel better about it. Yeah, so that's going to be kind of permanent. Yeah, fears, if you're over them, you're over them. You want to give your example?
Yeah, so just to show how this works, and what Richard is proposing, right, is basically to form a network or start a group of mothers, basically, or parents, doesn't have to be mothers, who wants to learn the technique so they can start working with each other for each other rather than to see someone specially, etc. So say, for example, like we have a client, not had, who has prenatal depression. and the depression is so severe to the point where it affects her physical self, okay, to the point where she was hospitalized because her blood pressure just plummeted and she couldn't even function. She was having fainting spells, etc. And I offered to Skype her, and because I've also learned from Richard these techniques, I offered to Skype her, but it was so bad that she doesn't even want to talk to me. The only form of communication was the WhatsApp group that we set up for all our clients, okay? So basically I spent, and I was in Brisbane, so I spent an hour, you know, and just working with her on WhatsApp, which is slower because you have to type and everything, right? And basically her blood pressure levels haven't hit normal range at that point. So she's just at home resting. And she has a blood pressure machine at home as well. So I worked with her for an hour to the point where it removed her pain and her sadness or depression or whatever and brought it down, not necessarily to zero. It did go down to zero, but it doesn't have to be. And after that, even though I didn't ask her to do it because I didn't know she had a blood pressure machine at home, she actually went to take her blood pressure. And for the first time in 5 days, her blood pressure went back to the normal range. Okay? So it's very strange, like, it's like, what's that all about? You don't see anything happening, but those who experienced it, you feel the changes in your body. Okay? So it's very intangible yet tangible. So for me, that was like, you know, I did it to help her. I didn't have any expectations or whatsoever because I figured, look, if I can help, I can help. If I can't, I'm not doing any harm. But because she actually measured her BP levels daily, and she did it after the session because for the first time in 5 days, she felt wonderful or weak. You know, she cries non-stop and all that kind of stuff, you see. So it was actually a tool that could help her. But the point is, you don't need, anybody can do this. You just have to want to learn it and can use it for anything and everything, whether it's physical pain or whether it's emotional pain or whether it's stuff like that. So of course there are stuff where like it goes deeper and someone might want to see someone professionally, but it's something that anybody can do. So it's a tool that anyone can use for anything and everything.
Yeah.
Okay, so I use it daily as well. When clients go into labor or whatever, you know, we kind of strengthen them on an energetic level and all that kind of stuff, you know. So it doesn't, like, even if I'm there or not there, it doesn't matter. You just we're just you know, working on it and you know,
So
we're
what
not
you're actually doing?
so you're not changing the outcome of nature. Nature has a plan, okay, but you're kind of bringing it back to equilibrium. Yeah.
So what they're actually doing? Sending positive thoughts?
No, there's a method. I mean,
Yeah.
if you did 30 years of Tai Chi and Kung Fu, then you'd know it. Yeah. So there's a method. I teach it. It's a very, very simple method. Okay. But I want people to get it properly. I don't want them to be just messing around. Yeah. Not really understanding it. And then having their own experience. So they've actually gone, okay, I came in with this problem, I felt so and so. So if you've got something you're bothered about emotionally, does anybody, if it's not too big, we could do it. If there's something you're bothered about emotionally, you can work on it in the same way. The body or the mind understands emotional pain as the same way as a physical pain. Yeah, there have been brain scans which show that. Like, emotional pain is as much pain as any other pain. So you can work on also these emotional issues. And because it's energy, you can work on every issue under the sun. So you can work on your business, you can work on, anything. Does anybody else got an issue they'd like to work on? We do it with. We do it also with. I don't know if you know anybody's done any NLP. Any experience with NLP? So, probably about 10 years ago, it was quite, or 15 years ago, it was quite popular.
You've gone through NLP in class?
20 years ago.
Yes, you have.
So,
without realizing it.
if I told you what it stands for, yeah, it won't help. NLP stands for Neuro-Linguistic Programming. But you could say our mind works in pictures, in feelings, in voices.
So like what we cover in class 1 with hypnobirthing, okay? Like how to communicate with your subconscious mind, so on and so forth. Yeah.
So that model was developed by Dr. Bandler and John Grinder. So they developed this model that said, so basically if you imagine, I don't know if you know about law of attraction, you imagine positive things in the future and you feel good about them, you're much more likely to get them. If you imagine positive things in your future and you don't feel good about them, do you think you're going to get them? No, you're probably not going to get them. So what we've done with my classes is also help people to feel really good about a positive future. So it's a lot of different